good evening, and good evening. This is yours truly, Dr. Luvuyo Payeni, yours and the host for Dr. B Talks. And welcome yet to another exciting episode of Dr. B Talks. As you know, we bring you real conversations, real communities, and real impact. Yes, we are back. And maybe I must start by acknowledging I don't have a cap on. I would have taken off my cap. Especially women in South Africa, as we are today commemorating 70 years of Women's Day, which is based on a march that took place 70 years ago in 1956, where women opted to take up a charge of fighting the system at the time, and they marched to drop what was then referred to as the Dom Pass at the Union Building. So today, we are joining the millions and the multitudes of South Africa who are celebrating and remembering that day. So as Dr. B talks, we also want to say we are grateful for the women who have taken a lead. And we also want to acknowledge and appreciate that we still continue to applaud and appraise the women who show leadership in their different aspects and different fields. And we do appreciate, and we say we see you, and we are saying that we are learning from you, and we are also following in your footsteps. But importantly, we want you to continue to lead in your various spheres and show that indeed when they say women are mogodos, it does not necessarily mean that they cannot feel or have any pain, but it also means that they are able to lead and they can lead us to the right path. So that's where we are starting today, just to make sure that we commemorate and we join in the multitudes. And of course, we did say when we start this month that as part of our contribution towards the Women's Month, as the month is regarded as a Women's Month in the South African context, we would also make sure that we feature topics that in the main would talk and resonate with our women, but importantly, we are also featuring guests that are women and they are leading in their space and they are going to be here to empower us. So yes, today we are no different. And yes, we did say that we'll always keep you on your toes when it comes to disclosing our guests for the evening. And you might have seen on the poster yesterday, those that were following our page, and you saw that indeed we are bringing you. Now I don't even know how to respond and treat her. She's also my boss, where we serve, but also I must say that when I started following and getting to know my guests, it was through acknowledging some of the work that she was doing, especially when it comes to leadership in the academic space, especially when it comes to, at the time, I was a very passionate clinician in the obstetrics and gynecology department. So I would always see and follow the work that and the leadership that she was showing, but importantly, the mentoring and the innovations and also the leadership she was showing to even young academics. So, and it so happens that following from the social media and seeing what she is doing, we happen then to be in some one conference and be like, oh yeah, that's the one. Yes, I'm the one that's following you on Facebook. Okay, yeah, I'm not a groupie, but yes, I was following her leadership and what she was posting on Facebook. So, and we met, and since then we have been involved in quite a number of platforms. Currently, we are serving, and she is my deputy chairperson of the HPCSA Medical and Dental Board, which I'm a member of. But apart from that, this one continues to lead that, make sure that she doesn't leave you behind. When she knows that you can contribute and she would like to collaborate, she does not leave you behind. I'm talking about I was saying earlier on, I don't know whether to say prof, to say doc, Kulu, or Salome. I always call her Kulu, especially when I know but I want something. And then, so I would like to take this opportunity to welcome Prof. Welcome to Dr. B Talks. And but I make sure that I do not say much because as our way of introducing guests here at Dr. B Talks, we also allow, as we start the show, for them to say a thing or two that I omitted deliberately as part of their introduction. So welcome to Dr. B Talks, and thank you very much for gracing us with your time. understanding that this is a long weekend, family time, but also you've got quite a lot of things to catch up with in your busy schedule. But we do appreciate that you made time for us on Dr. B Talks. So welcome, and let me allow you now to greet the viewers of Dr. B Talks. As you know that we are live on the Facebook page of Dr. B Talks, as well as our simulcast broadcasting partner, Sowetan. So please feel free to greet our viewers. We usually say we are a family here at Dr. B Talks.
Yeah. Thank you so much, Dr. B. Really excited to be here today and to join. I've been following from a distance the talks for a while, and so it's a great honor to be here today. Just in terms of my background, I am an obstetrician and gynecologist, but I'm, for the past decade or almost a decade, I worked as the head of global surgery at the University of Cape Town. Was really interested in access to surgical care. My interests are more in maternal health, cesarean sections, ensuring that women have got safe access to surgery when required for both maternal and reproductive conditions. But currently, I'm at Wits University as the head of the Wits Medical School. And so it's a great pleasure and honor to be here. There are many other things that I do and that I've done, for example, as the director of the WHO Collaborating Center on Integrated Clinical Care. So, yeah, I'll bring, I guess, many different views from a women's and maternal health perspective. Thanks.
Thank you very much. I'm happy you did mention that there's quite a number of things you also did and you do. But I know that you also write 7 pages of Sowetan for my resume. Thank you very much, Prof. And it is indeed an honor for us to have you as a guest for today. As I mentioned earlier on, and when we were starting, that indeed we are contributing and maybe also joining into the with the hands from Dr. B Talks to say August is regarded as Women's Month in South Africa. But of course, joining that will be also in terms of your health calendar, it then becomes your Women's Health Month or your Women's Month. But also at Dr. B Talks, we felt that we also would love to be part of the conversations that are not only confined to us, but a global talk. So in our show this month, we are looking at how we can get close to empowering our audience, empowering our viewers when it comes to issues that relate to women's health. Had a good conversation myself and you when we were saying, in actual fact, understandably so, if you're looking at obstetrics and gynecology, you need the whole year to deal with every single topic. Every Sunday you'll have a new topic to deal with. So we understand, but also what we have been doing here at Dr. is also to try and make sure that we enlighten and we empower. So we understand that sometimes we may not be able to reach as many topics that people would like us to do so, but we still do our part to make sure that we get close to empowering our viewers. Today, let's probably just look at when it comes to women's health, maybe one will say also gynecological health matters, but in general, women's health, when it comes to what would be issues of concern, how would we like to empower women when it comes to women's health? Obviously, without necessarily for today having to tease into particular conditions or medical conditions that they may go through or gynecological conditions, but just in general, if now someone comes and say, I almost said, if you're invited to come to church to speak on women's health and from an obstetrics and gynecological point of view, where would you start and how would you present that? So in the main, we just want to create that awareness. We want to empower, and of course, maybe later on in the show, we'll create some 10 minutes or so just to be maybe zooming into issues that relate to infertility, because that would also cover not only women, but us as male partners as well. So I know it might sound broad, but
Yes,
women's
yeah.
health.
Yes. Yeah.
How
Yeah.
do we start
So
the conversation? Yes.
yes, yes. So thank you very much. And I think, yeah, I really like that approach of starting very broadly to say, firstly, what is women's health, and then going into reproductive health and looking at what are the areas that one should be concerned about and which are the areas that one should pay attention to. So firstly, I want to say, before we even go into women's health and access to health and the different conditions, firstly, it's important that women take their health seriously. I think that's the one thing that's important to highlight first, because as women, as mothers, we're so busy. We're trying to save everyone and ensure that everyone is looked after. If you look at some of the statistics in the country on various conditions, you find women will often present late, when they've got, for example, and women will present late for diseases that can be cured. So if you look in South Africa, for example, when it comes to breast cancer, when it comes to cervical cancer, we've got very high first, because the issue is not so much that these diseases are not treatable, but it's that women will often
Sorry, Prof, without
delay seeking their
interrupting you
own
there,
healthcare first.
I just wanted
And
to
if you
check
don't
with my
prioritize yourself,
team
then you're not
uh,
able even to
if
look
we.
after your.
Okay, no, I think we are fine now. We sorted. Yeah, I think we sorted. Sorry about that. There was just
Can
a
you hear
technical
me?
glitch. We were attending with the team. Apologies.
Okay, can you hear me? Can you hear me, Dr. B? Can you hear me, Dr. B? Hello? Mm,
Yes, Prof. We can hear you.
you can hear me.
Yes,
Apologies.
yes,
I'm
yes, yes.
not sure at which point you lost me.
Apologies for that.
Yeah. Okay. Can you hear me though? No?
Yes, we can hear you. Thank you very much.
All
You may
right.
proceed.
Thank you. Yes. Okay. So what I was saying is that women often, will pay attention to their families and everyone else instead of their own health, and end up presenting late when they're in advanced disease and when they may not be curable at that point. So the important conditions that one needs to think about is your breast cancer, it's your cervical cancer. There are issues of firstly pregnancy. Contraception is very important when you look at women's health. Then menopause, as women get older, is also a very important phase in a woman's life that we need to look at. So from the time that a woman starts to have her period, as a teenager, up until they are in reproductive and childbearing age, and issues of pregnancy, and later on, when we have to look at issues of menopause and hormone replacement therapy when they get to that stage. So broadly, those are the areas in women's health that one would think about.
I think I am probably, I could argue that I'm excited on behalf of Dr. B12's family that you also made mention and had a reference to even your cancers, in particular your breast as well as your cervical cancer. We just fresh from a great conversation with a cancer survivor last week, and indeed one of the issues that was a take home and we got in that session was how she tried to make sure that she did not wait until she even fell ill. And for her, she shared and explained and empowered us that what was also good on her part was that she understood and understood her body. So when she noticed that there were issues that were not normal for her, that's when she went for consult, and that was one of the life-saving moments for her, because now she was able to go through the journey before she could even fall ill. So I agree, and thank you for reminding that we as women maybe get this Mbogoto thing also compromises us as well. That as women we would find a situation where we feel that let's prioritize others, and then we put ourselves at the back end and delay even dealing with our own issues. So I think that's one of the issues that we want to raise today. Yes, there's nothing wrong with being caring for others, but importantly, try and not make it at the expense of your own health, and such that you start later on. And maybe let's just try and empower and look at, others will say that no, those are women issues, those are women symptoms, those are issues that even us as men, you come to me and you say, baby, I've got a low abdominal pain. I'll be like, that's gynae, man, I'm clueless. So what is it that maybe you would say we need to probably be more observant of, maybe for a lack of a better word, or maybe to be intentional in responding to, when we get some of these, what I would refer to as probably mostly associated with gynae issues, even if they may not only be for gynae, like the example I made of low abdominal pain for that matter.
Yes, yeah.
Thanks.
So before I even go there, I just want to mention a few things that complicate or that make women's health a bit more complex and complicated. So one, as you mentioned, us as women educating ourselves and ensuring that we understand about the woman's body, the women's condition, the reproductive conditions, maternal health related things. If a woman is pregnant, at what stage does she first go and see a doctor or go to the clinic, for example? So education is important and empowering yourself. But the challenges that women face, one is the stigma. So some of these conditions, especially gynecological conditions, there is often a stigma related to it. So if, for example, you are bleeding and having abnormal bleeding, or for example, you've got this persistent pain or you've got a growth, most women, or a discharge that you were not, a discharge or pain or ulcers, all of these things, women are often afraid to firstly talk about it. So those are some of the things that, who do you talk to? Do you talk to your mother? Do you talk to your friends? Do you talk to your sister? And then even if it is your spouse that you are talking to, they might not, they might assume that, for example, that now, for example, you've got a sexually transmitted infection, that raises new challenges for you within your relationship that might have to do with trust, etc. So those are some of the challenges. It's stigma, it's issues of trust, it's how you're going to be seen once you've got some of these symptoms, the poor communication. Our mothers may have struggled with certain conditions, but they did not talk about them. And so I've seen often, for example, when a woman has a miscarriage, and now you're telling your mother that this is what I've gone through, suddenly your mom might tell you that, oh, by the way, before you were born, I also had a few miscarriages. So often we don't get this information until we are in that situation. Issues of, for example, breast cancer, you might find that a grandparent or something may have died from breast cancer, but it was not communicated in the family. And as a child, you were not informed. And so it's only later on that you find out about these things. I also want to touch on some of the complications that one may have as a result of pregnancy. And you may find that later on you have, what we call fistulas and whatnot, that affect really the intactness, I guess, of your muscles in your reproductive muscles, etc. And so again, you'll find that our mothers or grandparents may have gone through that, but would have never spoken about it because it's not found to be acceptable, for women to be going through these things. And so the passing down of knowledge, it doesn't happen so well when it comes to women's health and reproductive health. When you suffer from diabetes and hypertension, it's easier to educate the next person that, watch the salt intake, watch this, But when it comes to gynecological issues, often that's why even within families and communities, the education doesn't happen because there's often a stigma related to it. And lastly, let me touch on women's rights as well and human rights, because whilst some of these decisions we should be empowered to make for ourselves, but often within a family setting, you might need to, and it might be expected of you that you need to get consent from your spouse, whether it's for contraception or for a procedure or something. And sometimes in some communities, women's rights are not regarded highly. And so you may find that women are not often given the opportunity to prioritize their own health when it comes to gynecological or obstetric conditions.
Prof, I was just particularly taken aback and maybe appreciated how you also raised and enlightened us that equally so women have got obstacles, if I can use that. um, Women have got obstacles. Maybe just before I continue, let me just acknowledge that the team is working to correct and maybe work on the issue of the sound. I've noticed that Buli as well as Nhlakanipho have commented to say let's also be mindful that there was some technical glitches with the sound. Thank you very much for raising that, and the team is working on that. Apologies once more. So as I was just trying to reflect, Prof, that one of the issues that you mentioned was to remind us that women also have got some obstacles, if I can use that word, that they then also have to overcome, even having to deal with their own conditions or own um, gynecological issues. And I think it's one of those issues that we sometimes probably overlook, that you might be afraid to speak out because you've heard how people respond to anyone who has got any symptoms similar to STI, for instance, and you are worried that you will get that label. You've also mentioned that sometimes even the issue of empowerment, that you don't just talk in terms of the being empowered on women's rights, and that it's something that also creates a bit of a hurdle for women to raise. But also, I think you are reminding us the issue of the importance of sharing family history, and that let's encourage families to find space, find time, and get comfortable to share that, by the way, your grandparents had these medical conditions, and your immediate parents also suffered these conditions. If they are no more, or if they are still alive, they should be able to express and share what medical conditions they have, so that at least we don't miss out on the opportunity of empowering women to understand what is it that has been there in their family. So I think you've touched on these issues, and it really help us as this DrBTalks family to be empowered and to understand that maybe this is where we need to be starting as well, to say, before we can be saying how to deal with issues that women go through, or how to identify some of the conditions that women go through, but let's just clear and understand that we can play a role in reducing or minimizing the hurdles that they also have to go through. Thank you very much for that. I think it also does assist, and also the fact that you mentioned that some of the issues will probably be issues that we might have overlooked, that come from previous pregnancies, come from previous other obstetric history, that people might have. So that correlation and mixing and understanding that when you deal with any women condition now, it might not be only a thing of just coming from now, but it talks to everything else that you have been through. So thank you very much for that. And I appreciate that you were able to bring us back to understand and also get a sense of appreciation that women also have got these hurdles. I know we say that a lot about men's health when we say men don't talk. They'll be labeled as weak, but I think the fact that you are bringing this element as well when it comes to women's health, I think it's also an empowerment for us. Yeah, so you can continue, Prof. But yeah, I'm just excited that everything is coming together. And let me also just remind all those that are tuned in, if you would like to drop a comment, please feel free to do so, because we always encourage that at DrBTalks, this is a family and as well as conversation for all of us, and we learn from each other. So those that would like to just bring a comment, share some experiences, and also express how they've overcome some of these hurdles, but also how they've been learning or trying to mitigate against some of the issues they face when it comes to dealing with women's health. Also, some of those males that are on the group, please do share your experience, whether it's from a professional background or from a spousal or family background, and in terms of what you have also come across in understanding and dealing with women's health, especially when it comes to the hurdles that have been mentioned as well. You may proceed, Prof. Thank you very much for that.
Thank you very much. So I guess let's start with the young women, or maybe even just, yeah, there's a young woman with a teenager who might be, at the age where one should be starting their puberty and having their first menstrual period and having the changes that they have, the physical changes, the growth of the breast, etc., and the issues they are normally with the delay, or is it starting early, too early, or is there a delay? And so it's important, for example, just to pay attention to that, because when a woman comes to you, for example, she's 16, 17, or she's 20, and she's saying, I've never had a period before, then now you are wondering, why did you wait so long to come and see us about this issue? And then, so the menses are usually the first thing that one would link then it's issues, for example, contraception, and that's when women will be starting contraception, deciding which is the right contraception for me. That depends on their age, it depends on their sexual activity, it depends on their choice, preferred choice, and all of that. Do they prefer something that's hormonal, non-hormonal, etc.? And often, when one wants to start contraception, you need to go and educate yourself, meet with the gynae, go to clinic, and start to have some sort of
Sorry about that, Prof. Let's try something. I hear that there's still continuing. Sorry about that, Prof. Sincere apologies from our side and the technical team. The glitch was still continuing. Let's quickly do, maybe let's just swap around. Let's try use the laptop mic, and then let's mute the other gadget and see if we're gonna get a better reception. Apologies to the viewers. We are trying to work on the technical glitch. Sometimes, I become positive about these issues and say, this is what you get from getting live feeds at DrBTalks. We're trying by all means to make sure that we bring the conversation live. But sincere apologies. I know we were all glued and starting to take some notes. And I see that even the viewers continued to remind us, and even Dando. Thank you very much for that reminder. Let's see if we are able. Prof, are you able to hear us very well, loud and clear now?
Yes, much better. Thanks. Okay, can you hear me?
Yes, we can hear you, and you are much louder and clearer. Let's hope nothing is going to interfere.
Right.
Yes, you may proceed about that. Apologies once more, Prof.
All right, no problem. Thanks. So as I was saying, I started off by saying that we need to look at the woman, the teenager, first of all, the adolescent, looking at issues about their menstruation. Does it start early? Does it start late? Issues with their development, the breast, the growth of the breast, etc. And is it aligned? The main issue for me is, women, when families pick up these things that, girl is 15, 16, 17, she has not been having her menstrual period, they need to try see a gynae and try go to the hospital, discuss these things, because you don't want to come when a woman is in her 20s already trying to fall pregnant to say that she's been having she's never had a period before, or she's always had irregular periods, but you've never consulted with anyone about it. Then I was saying the next phase is looking at things like contraception. When women are now ready to start contraception, it's always good to consult with a healthcare worker to determine what is the best choice for you. You know, do we go for hormonal, non-hormonal, etc.? There are many issues, there are many things that would help you to determine what's the right contraception. And at different stages of your life, we are younger, you may want a different contraception, certain contraception, which one may want when you're younger, you're not planning to fall pregnant anytime soon or in the coming years, will give different contraception to someone who is saying, in a year or two, I want to fall pregnant, but for now, I want to use contraception. Then the other things, sexually transmitted infections, it's also important because it will have a contribution it will contribute to your fertility in the long run. It can be associated with other complications that could become life-threatening as well. We also know with HIV as well, it's also a very important consideration. So discharges, I think, is an important discharges, ulcers, sores, bumps, all of that, any abnormalities that one might find those are things to report and not wait till too long to consult, because you don't want to have complications that you shouldn't have because you didn't consult early enough. Then the other area is pregnancy. And the real issue is, as soon as a woman finds out that she's pregnant, it's important that you then start to consult, find a gynae, go to a clinic, start attending antenatal clinic. Why I emphasize this is, as I said earlier, with some of our our cultural issues, women will wait until they are showing, before they go. When our mothers and grandmothers say, don't tell anyone you're pregnant, they are not including the gynae, still go tell your gynae that you think you're pregnant. Let's do the test. Let's screen to see if there are any potential abnormalities in the baby. Let's ensure that you are healthy early and throughout your pregnancy. Then afterwards, as women have things like low abdominal pain, there are many different causes, from fibroids to endometriosis, and so don't assume you know what's causing it. Go to the clinic, go to a doctor, go to a gynae, let's do ultrasounds, let's see what's going on. Let's put you on the right medication. And then as the woman gets older, then we need to consider issues such as menopause. And as they start to have hormonal flashes, hot flashes, etc. And again, find a gynae. Let's discuss what the options are for us to support you with the symptoms that you have. So I guess broadly, I've tried to cover, different conditions. But of course, as I mentioned earlier, that various cancers. One can get cervical cancer, ovarian cancer, and cancers in the uterus itself. And so there's a lot of conditions one can have. But most importantly, when one suspects that they've got pain, abnormal bleeding, abnormal growths, discharges, etc., that you need to look for help.
Thank you for that, and especially when you took us through to say one of the issues that you would like to bring forward is that let's not assume we know what symptoms we're having and we think we'll deal with them in our own way. Because at the end of the day, the delays is what we are more worried about, that it may cause more complication and more harm. So please, let's consult when you have those symptoms, and some of them she had mentioned. issues that, especially issues that you know that are not normal for you. If you're not used to discharges, you're not used to itchiness, you're not used to. So please make sure that issues that you know are not normal for you, you do consult whenever you get those. But what other issue I wanted to just tease you on? The what value add role do we play as men when it comes to gynecological issues, and especially coming for those consults and symptoms? Where do we stand? I know earlier on you did mention one risk that is there with us as male, which we need to improve on, is the projections of maybe being judgmental or of labeling if the female says or expresses some of the symptoms with us. So I know that you mentioned, and I took note of that as men, it's something that we must try and do differently. That when a female partner or a female person shares some of the concerns or symptoms, we should not be so quick to then want to label or judge them or categorize them or classify them in terms of what we think. Um, just, I want to tease you on that one about males as I'm going through some of the questions that we're going to go through from the audience and see what is it that they are also sharing before we move on to the next part.
Yes. Yeah. No, absolutely. I think when it comes to gynae conditions and obstetric conditions, the male partner plays a very important role because, because one, yeah, I think firstly, in terms of these issues will affect the women and the sexuality and all of that. So I think there's a direct role that the partner plays, sometimes in even picking up some of the conditions, but I think what's most important is the support. Providing support, encouraging that go and see a gynecologist or go and see a doctor. You can go together, and be part of the discussions and all of that. But I think more importantly is trying to be a supportive partner rather than stigmatizing the woman because of the conditions, because of perceived thoughts or stigmas around the conditions that she may have.
Wow. Thanks. And also thank you for reminding us that when we say don't tell people about certain things, it does not mean healthcare workers. Yes, we respect that people have got this traditional and way of bringing up our women or their girl children, but let's please remind that that line exempts healthcare workers. So you must come through and share if there is anything that is affecting you when it comes to health issues. So thank you very much for that. Now, I would like us, before we come towards our conclusion, I know this one, the advantage with it is going to empower both males and females, and maybe also in-laws to a certain extent. Infertility. It's something that I know that we probably do not have as many platforms that tackle it or talk about it. But it's also one of those that you were upfront about saying there's a lot of stigma and that becomes a hurdle when it comes to issues that relate to that. I know one of the issues I always enjoy raising when it comes to infertility is that it is not one-sided, because I know that we always want to be so quick to say it's kulomfaz bacho pa emakhaya kulomfaz. So just take us through infertility.
Yeah.
Yeah.
Yes. So, I mean, infertility it's a very big, I guess, problem, let me say, or a serious condition. And the issue about it's not just the infertility itself as a condition, but it is what infertility does to the woman, how the family may perceive it, how the community and society perceives it, and then the access to fertility services is another issue that I'll touch on for now. But you'll understand that, especially in African cultures, in African families, for most families, when a person gets married, they are looking at, the woman is going to bear children for us. I mean, and it gets worse. She's going to give us sons and whatnot. Now, for a woman who is now not able to fall pregnant, our culture and our society has not helped us yet, or put us in a place where there is compassion, for example, for that. Women who have, reproductive aged women. You meet a relative on the street, you meet someone on the street, they are asking you, when are you having your first child? But even the woman who's had 2 or 3 children, they'll keep asking you, when is the next one coming? And it seems like even when you've decided that I'm not having more children, society doesn't accept that that it can be normal for women not to have children. But the condition infertility, it is a common condition that happens. There are various causes, many causes to infertility, and it can be on both sides. It can be on the female side, it can be on the male side. And so when one suspects that they may have a fertility issue, they've been trying to fall pregnant with unprotected sexual encounters, and they are not falling pregnant, at that point, then, it's been a year, for example, then you can consult with a gynae, you can consult with a doctor and start to see what investigations need to be done. Is it a hormonal problem? Is it an obstruction somewhere within your reproductive system? Is it in the male partner? And so there are various tests and investigations that can be done. But once you've diagnosed and once you've found out what could possibly be causing it, the difficult part in a country like ours is that fertility services are not readily available and they are not always affordable. And so that's the real challenge that women have in a country like ours, where if for example, if you wanted to have fertility treatment, it's very expensive and most women will not afford it, and most public hospitals will not offer it. And even if you've got medical aid doesn't necessarily pay for certain fertility services. And that's where a lot of women or families struggle with the condition again that can be treatable, but cannot afford to treat it because of the high costs which it comes with.
Yeah, thank you. But I'm going to take us back first. We'll come to the access and the services because you've mentioned some sad realities. Let me call them that, because you've mentioned the issue of access and the service package thereof. Now, I wanted the emphasis on what you said, that before we can decide to label people as having a problem of infertility, maybe we must stop as the outsiders, because this is a decision on family planning. For one, you may find that someone has decided they are not ready as yet. They just got into the marriage. Them and the partner have agreed that they are going to start by doing A, B, C, D first before their children. But when we meet them at the mall, we're saying, Makoti, it's been a year. When are we coming to take a teaser and all that? So I think that's one thing that we must also understand, viewers out there, that please let's also understand that issues of family planning and deciding to conceive equally become the issue between the two partners. So before we make those allegations or labels, let's also give them some space. But secondly, even between us as partners, maybe somewhere, somehow, sometimes I might not have said that I'm not ready and I'm doing something about it, or whatever. So even amongst us as partners, I think let's encourage the communication, the transparency. Let's have that question: are you ready to have a baby with me? And also, let's find out: are you taking any contraceptions, or are you on any preventative measures for you, because you said you're still not ready and you are not thinking of having the child now? And then we see how we work around it. and also just make sure that we have those open conversations before we can start saying, now we're gonna go forwards examination. Because I do know, Chindoba, you probably also as clinicians find it very sad and hard to deal with when a couple walks in and saying we are here for infertility workup, only to find that when the partner walks out, the other one says, actually, I've been on contraception, I have not told you. Now it changes everything. So I think let's improve on communication as partners. Let's make sure that we do talk, we do share, we express how we feel about making babies or family planning in general. There is a comment there that I would like us to go through as we continue to digest the issues that we are talking on, especially now, talking mainly on infertility, from Bulima Bai. She says, it is very rare to get support from a man, especially when there is a discharge and is smelly or itching. First thing you will hear is, why are you sleeping around? And
Sure.
be a victim in a relationship because
Sure.
and I think this is just an expression, or going back to the issue that we spoke about, the hurdles that women have to go through when they want to express or want to deal with symptoms that they are going through. And maybe just to be specific in this case, is that also, how do we get out of that myopic thinking of saying a discharge is therefore linked to having slept around or having multiple partners and that?
Yeah, sure. I mean, these are difficult questions and these are difficult scenarios. I think even just a woman going through a period, it's not always easy to say and just declare that, oh, I'm going through my period now. It's not that I'm not interested, I'm just going through my period. So, how much more a woman who's got a discharge and in a relationship where there may be trust issues? And so these are challenging, and it makes you have to then think about beyond the how do you disclose, or what happens, the health of the relationship itself. Those are some of the things that one needs to think about. Recently we've been seeing a lot of sad cases. you know, I think you've also seen some of these, relationships when men murder women and all of that, murdering their wives and things like that. You start to ask yourself, what is behind all of these things? And so whilst we can talk about the gynecological health and all of that, but there are true relationship issues that are at the core of the fiber of our society that we need to look into. And if we don't address some of those issues, I can tell you that disclose and feel free to talk to your spouses about these things. But then the next morning, you are brought to hospital in crutches with broken bones, etc., because of the relationship dynamics that were there. And again, as gynaes, we are on the other side, where you receive women who've been raped, women who've been physically abused, etc., women that are coming to hospital to say, just rescue me from my spouse, admit me, just, I need to get out of this place. So I guess she raises important issues, but one cannot really give proper answers because there is a lot more to it than simply expecting that everyone will be in a safe relationship where they can disclose these things as they happen.
Yeah. Um, and trying to thank you, Prof. I think maybe in trying to also get close to, especially the realities that are out there, Bully, as you had posed the comment and the question, is that we equally do have this concern that the relationships in terms of their own maturity of handling and how they deal with communication and dealing with issues. as healthcare workers, we are limited because we may guide and advise that do share, as Prof has said, but we might not know the maturity of the relationship itself when we don't get that insight. But importantly, I think, is to also try and advise and empower women to say, maybe without us having to put you in a situation where you become a victim, or you get to succumb to this unintended consequence of either verbal abuse or physical abuse or the relationship breakdown. Please, before maybe you want to share, also do take analysis of how your relationship and how do you guys usually communicate certain things. If it works when there's a third person, maybe just say, can you accompany me? I would like to go and consult, and then the third person can talk and expand on issues that relate to discharges and all those things. So we would like to still protect women in terms of not having to make them vulnerable, but also we want to empower you to say it also should not be your problem, or you shouldn't keep it to yourself, to make sure that at least we do get to share and become open about this issue. So thank you for that, Bully, and thanks, Prof, for sharing, especially the burden that comes with relationship statuses and relationship maturities that we have to deal with. And earlier on, we had started a conversation on taking us back to the core topic and the conversation to even ask now, can obesity contribute or cause infertility? And just before we get to respond to that, we were also saying that before we even get to come to the processes of the examination, let's just remind that as the couple, this is a conversation that you must always have together, because it would also not help to be having one person to say, I'm going to get up and go and get tested or go consult for infertility. It takes two to tango in this case, and it's always advisable that the couple should come through together. That's what Prof was advocating for. Prof, simply just on the question from Modi and maybe any other ones that you think you would want to just clarify and that comes to mind in terms of contributing factors thereof to the issues of infertility.
Yeah. So on the question, can obesity cause infertility? So the answer is that infertility, there are obesity on its own does not necessarily cause infertility, but there are conditions that are linked to obesity that can result in infertility. So it is common to find that someone who's obese may also have infertility. There might be other conditions, PCOS, hormonal, etc., that may be linked. So it is important that if you think that you've got obesity, you think that it's the cause of your infertility, go and consult and do the necessary tests, because the associations and links could possibly be there.
All right. Apologies once more on that. But I think, Prof, you had been clear to say we have not regarded it as a direct cause of infertility, but we are acknowledging that there is a linkage to. You may find that the person may have that comorbidity of obesity with something else that may have contributed to the infertility. So, directly put, yes, you may find someone with both obesity and something infertility. So we're just clarifying that part. I hope it does help to ease in terms of that question that was posed. Yes, I think because I'm worried, it's 53 minutes now. Yes, we left with 7 minutes to the show. It's always a challenge with us. I wanted us to also go to, maybe for the purpose of today, is to remind our viewers that it's always advisable to consult. But also, I think, Prof, you did mention that give yourselves a year to attempt to make sure that you create time for yourselves. You are intentional about the planning of the baby or family planning, and you have been making efforts. I know when I was still an active clinicians, we used to also get someone that would then come and say we are worried about infertility, but when you establish the one partner is always away, comes back once in 3 months for one weekend, and sometimes that weekend when they come through, they other micimbis and other things, they usually don't even have enough sex when they are together that weekend. So now it's 6 months later, they say we've been trying to have a child, we don't have a child. So please be intentional and give it time and make sure that you have been committed, both of you, to attempting to make a baby before you can come and say you would like assistance. So I think that's one message that we would like. And obviously, Prophet indicated, but when you come for investigations, there'll be different parameters to look at: male factor, female factor, hormonal factors, and medical conditions. So even gynecological conditions, obstruction, and all those. So please understand that the process you are going to be taken through will then outline and be explained to you what measures and steps will take place, and just be free to go and make sure that you are participating in the process. I'm trying to summarize because I want us to touch on, before we leave, on this part of the access and the services thereof. And
Yeah.
one of the issues that I liked is that you did indicate that families must not feel hard hit. It's not only about them. It's just the nature of the service itself, and how it is inaccessible, not only where they stay, but in the country, but also maybe especially in the African continent in general. So I wanted us to go back and make sure that we do support and emphasize and make people understand that part, that the access itself. And what I also liked was you even went further to maybe comfort those that would feel it is because they can't afford or they are not on the medical insurances. Because you even said it yourself that even though you may be on insurance, there are some of the insurances that don't accommodate some of the processes and steps that may be there. So it is a reality. So I just wanted us to make sure that we go back a bit to that in terms of just enlightening people of this access barrier issues, but also empowering them to say, don't feel hard hit when you are in that situation of having access issue. But also maybe lastly is for us to just give some hope in terms of there are inroads that have been made, and there are efforts that have been made, and people should just be optimistic where they've been having some impatience or experiencing delays.
Yeah. Yeah. And I think what's also important, particularly with infertility, is understanding where you should seek medical care. So, for most conditions, you could go to, a clinic, see a GP, see a gynecologist. But when it comes to infertility, there is what we call infertility specialists, and they deal fully with infertility and managing these cases. You have them both in the private sector and in public hospitals. And it's just important to say, because often I see women who they kept going to their GPs over and over, and we're getting treatment when we're not seeing the right specialist for this, and because of that have never gotten the right investigations and the right treatment for it. So it's important that if you really have been diagnosed with infertility, that you are referred to an infertility specialist, or you go to an infertility center. Some of them you can, get a referral, go there, and then have the right consultations about it. So just ensure that whilst educating yourself for this particular one, I think it's always important that you are seeing the right kind of specialist for this condition.
Yeah, thank you, Prof. As you are preparing for your closing remarks, I think I like the fact that you are reminding, and maybe it goes both ways. One, to us as the audience who become the clients, that once you have been duly diagnosed, um, please do understand that you may need a different practitioner or a different service or a different clinic. So as much as you might be so grateful that Dr. B has taken you through the journey, it's been taking you 6 years to get the diagnosis. Now you finally have it, but understand that Dr. B might be limited going forward. And there is nothing wrong with you asking for a referral, but also for us as the practitioners, please let's also put the patient first. It's reminding me of the topic I spoke about during the week of multidisciplinary teams, that at the center of it all, it should be about the patient. So we know our limitations, we know our expertise, we know which fields we are in. So it is also a right thing to do, an ethical thing to do. Maybe now it's our cape of MDB. So let's make sure that we do volunteer and offer referrals. It doesn't take anything away from your client. It doesn't mean that want to be part of the treatment of the client anymore. But it just means that you are taking the client actually, and you are putting the client first, and you want to prioritize them for going forward and getting the care. So let's make sure that we transfer and refer them to the appropriate platforms that needs to be assisting them. And lastly, for us is to make sure that when people are referred, they are referred appropriately to the right people, and also they would get the assistance that they deserve and be able to be managed and supported in making sure that they get the right treatment. So thank you for that. And I'm emphasizing this because on the platform, we've got everyone. We've got clients, we have got also our practitioners. And it's important for us to understand that we must work together and also make sure that we put the patient first. So for me, it's all about making sure that at Dr. B Talks, we make sure that there's real conversations, there's real communities, and there's real impact. So that's why I was systemic in trying to remind that once we get the diagnosis, let's be comfortable to say thank you, and I'm happy, and please where to from here. And you rightfully did say that there is access, there is clinics, both private and public, that deal with the specific specialty of managing infertilities. Prof, we have been talking and having a conversation, great conversation with you. You have empowered us in terms of women's health issues, and you have given us some insights in terms of when to start looking out for assistance. But importantly, you started by empowering us and reminding us the hurdles that women go through when it comes to issues that relate to them responding or dealing with their own health issues. And the main one being that of putting people first, but also the hurdles of stigma, as well as the issues of women empowerment in terms of women's rights. So we appreciate all that. Now, I would like to give you a moment to just share and have some closing remarks for us. And unfortunately, we have come to the end of the show. And we have reached our 1 hour. And we always say here at Dr. B Talks that we have asked our audience to avail an hour of their time on Sunday. So we always try and make sure that we don't keep them too long beyond the hour that they have offered us, because we still want them to come back next week. And we also want to show them that we appreciate their time. Your closing remarks, please.
Yeah. So firstly, thank you so much. I think it's been really wonderful having this talk and engaging in it. I think so often we can speak purely about the medical side and gynae side, but the truth is it's a journey. It's not just the disease and treating it. For women's health, it's the journey, it's the right, it's the women's rights, it's it's the emotions that women will go through before and after they go and seek help. And so I appreciate that we're able to talk about the patient journey or the woman's journey and not just about the diseases that they go through. But maybe just to say Happy Women's Day to all the fellow women out there. But also, in addition to say it is Women's Month, so let's also do something to look after our own health this month, whether it's reading, empowering ourselves, doing that pap smear that you've been prolonging for a long time and not doing it, doing a breast examination. Maybe let's take this month to do something, an important sign, or to look after our own health. And also, I think let's also destigmatize women's health and create supportive environments where we can talk about these things with family members, with our spouses, etc. And so I think as it's Women's Month, let's use the opportunity to have those conversations which we wouldn't ordinarily have. And hopefully, as time goes on, it gets easier and easier to talk about women's health. But thank you very much. I've enjoyed my hour with you, and thank you for the opportunity.
Well, there you have it, folks. That's it from our prof, and we have been honored as the platform to have her as a guest today. And I think she even has summarily touched on a lot of things that we stand for at DrBTalks, and making sure that with every show we would like that one or two people can say from today onwards, this is what I'm going to do differently. And she has even put in a challenge to us to say, during the Women's Month, can we try and say this one thing that will contribute towards my health as a woman, towards empowering other women with health, whether it be information, whether it be education, but also the examinations and any other investigation that we may be able to take. So thank you very much. And I would not want to spoil it any further. We are continuing at DrBTalks with women empowerment and supporting and commemorating the Women's Month. And yes, we continue to bring you real conversations, real communities, as well as real impact through DrBTalks. And we always appreciate our simulcast broadcasting partner, which is Sowetan Live. And welcome to all those that were always looking forward to an opportunity to join, and they finally made it on Women's Day. So that's how we also commemorate Women's Day, by welcoming all the new members that have joined in terms of the DrBTalks. But continue to share and advise and invite everyone to follow the DrB page as well as Sowetan page, both on YouTube as well as Facebook, so that we can continue to grow the family as we want to empower as many people as we can. So that's it for tonight, and it has been a great pleasure to host you, my prof, my doctor, like the home kulu, my boss. It has been a great pleasure to host you. And yes, we are looking forward to further engagements with yourself and further support through DrBTalks and other platforms that we may be having, to invite you to always share your knowledge and impact further knowledge to the viewers. So thank you very much for that. And that's it for tonight. It has been a great pleasure. See you next week, same time, same place at DrBTalks. Yours truly. Happy Women's Month once more. By the way, Kaizer Chiefs is playing, and so we will also be checking and catching up on that. Thank you very much.